If you've been dealing with the pain, the fogginess in the head, the inability to sleep, the inability to concentrate, all of these things after you've had some kind of a head injury, a concussion, but you haven't been getting the results that you would be expecting to in this period of time, I want to ask the question, is it possible that it's not a head injury you have, but maybe it's a neck injury? Hi, I'm Dr. Jeffrey Hanna at Atlas Health Australia. And what I want to share with you in this video is a little bit of research that I've been looking at that's describing what is going on when people suffer what's called post-concussion syndrome and how it may not actually be a head injury that's the actual issue. Now, I'm going to start by saying that something like a post-concussion syndrome, unless you're talking about visible swelling, bleeding, or something like that on the brain, this isn't something that you're going to be seeing on a routine MRI scan. And it's because this is the kind of thing that is affecting the way that your brain and nerve system are working. Think of it as the difference between a computer, one where it's got a crack on the screen or broken keyboard, versus a computer virus. Both of them are going to affect the way your computer works, but one of them you can see plain as day, the other one not so much. And it's because it's a functional or a neurological issue. Now, what I want to illustrate then for you is that when you are dealing with the symptoms of a concussion, so it's the complete loss of energy, it is pain anywhere in your body, headaches, migraines, loss of balance, a fullness or a pressure inside of the head, inability to think, inability to remember things, all of these different things that can be going on as a result of a head injury. What's very interesting and what you may not have realized, or maybe nobody's told you before, is that you can have all of the exact same symptoms when you injure your neck, such as in a whiplash injury. So to help with this, I've got a little model of the base of the neck. So you can imagine where this is where your head would be sitting, and then this is the normal curve of your neck. Now, we're going to imagine that there's a bowling ball on the top to represent your head here. And if you've ever knocked the head and all this sort of stuff, okay, that's severe enough. But I want you to imagine what would happen, whether it be in a sports injury, whether it would be in a car accident, whether it would be in a work-related accident, something where your head and your neck suddenly accelerate and deaccelerate like this. So even if you don't necessarily hit your head on something, what it can do is it can produce a sharp stretching of your spinal nerves, of your muscles, and of your ligaments. And then if something gets stuck that way, even though all of the symptoms seem to be focused here, and even though all of the tests that you maybe have had have been focusing on your skull and on your brain, you might be missing a very, very important piece of the puzzle. And now the same thing can actually happen then if you were to hit from the side like this, or if you were to trip and fall, or if you land on your shoulder, or even if you land on your tailbone. And the reason for that is because any and all of those different movements, what they can do is they can produce a whiplash effect through your neck. And if something gets stretched through your neck, it's going to start to pull, or has the potential to start to pull, and disrupt the normal function of your brain. It can affect the way that fluid is going to and from your brain, which ultimately is going to impact how well it is able to work. And these kinds of things, again, you don't necessarily see them on a brain scan or an MRI or anything like that, but they have a very real effect as far as how things are working. So what I want to ask you is this very simple question. If you have had some kind of a head injury, some kind of issue that's been affecting you, you've been diagnosed with a post-concussion syndrome, have you also had tests done of your neck? And how precise have they been? Because if you've actually been going along, trying to carry on with your life, but not having your neck attended to at the same time, there could very well be an underlying issue that you have not yet been able to resolve. And if that's the case, what that means is that you may need specific care targeted to the alignment and restoring the motion through that critical area of your body so that your brain, your nerve system actually have the ability to heal themselves. because as I'm sure that you've discovered, when you're talking about whether it's a head injury, a neck injury, or anything like that, it's not just a matter of head pain, neck pain, or anything like that. We're talking about something that is affecting your brain health, and that is a whole body health, well-being, function, quality of life kind of issue. That's what we're talking about, and that's the kind of thing that we're looking to ultimately help people with. So hopefully I've given you something to think about in this little video. If you do have any comments or any questions, please do jot them down here, and check out or share this video with anybody else that you think may need to hear the information here. If again, they've had some kind of issues going on with the head, with the brain, their ability to concentrate, but they haven't been able to figure out what's going on. Maybe because they just haven't been looking on the exact right area of the body. So if you were looking for any more information, then what I'd encourage you to do is to check out some more of the videos that we have on our channel here through YouTube, through Facebook, and also go to our website, which is atlashealth.com.au, where you'll find all kinds of additional information about the role of the neck in your overall health well-being, in addition to what that means if you've been dealing with injuries to the head. Thanks for watching. This is Dr. Jeffrey Hanna at Atlas Health Australia.